Hi everyone, today we'll be discussing how to get pregnant with polycystic ovarian syndrome, also known as PCOS. Polycystic ovarian syndrome is a health problem that affects about 1 in 10 women of childbearing age, women in their reproductive age. Women with PCOS present with health problem, mostly hormonal imbalance and metabolism problem that affect their overall health and their appearance. PCOS, that is polycystic ovarian syndrome, is one of the most common causes of infertility and is also a treatable cause of infertility. My name is Dr. Nkiruka Bridget. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health. Subscribe to my YouTube page if you have not done so at OBGYN Talks with Dr. Adazion. Follow me on Facebook, TikTok, and on Instagram with the same name, OBGYN Talks with Dr. Adazion. Polycystic ovarian syndrome is a health problem that presents with imbalance in the reproductive hormones in women. This hormonal imbalance creates a problem in the ovaries, and the ovaries are what makes the egg that are released every month as a normal menstrual cycle. In women with polycystic ovarian syndrome, the ovaries may not make this egg as it should, or this egg are not released during ovulation as it should. So people with polycystic ovarian syndrome present with different symptoms. Well, some of the commonest symptoms they present is menstrual irregularities. Most times they will come with abnormal menstrual cycle length. Remember in my previous video I said that the normal cycle length is between 21 days and 35 days. You see people with PCOS, that is polycystic ovarian syndrome, presenting with long menstrual cycle length. Sometimes their menstrual cycle length is above 35. Others may have a very short menstrual cycle length, while a small quantity of this group of people will have normal cycle length. However, ovulation is mostly impaired. Now, most of them present with infertility. Infertility is that inability to conceive. It's common with polycystic ovarian syndrome. However, it's one of the diseases in polycystic ovarian syndrome that can be treated. So, infertility is one of the commonest presentation in people with polycystic ovarian syndrome. Now, they can also present with other physical appearance symptoms like change in their voice. Because in polycystic ovarian syndrome, there is a hormonal imbalance. One of these imbalances in the hormone is that they have the male hormone called androgens. Androgen is higher in them than in the normal female population. So I see someone that is with polycystic ovarian syndrome, the voice changes from a feminine voice to a masculine voice. So there is a change in the voice of someone with polycystic ovarian syndrome. Then sometimes we see them present with hirsutism. Hirsutism means presence of hairs where they are not supposed to be. They have this male pattern of hair distribution. You see someone with polycystic ovarian syndrome presenting with hairs on the chin like beards. You see them presenting with hairs everywhere. You see the person hairy and you're admiring the person. Most times they see their body, they have hairs on their skin. If you go to their chest, you may see hairs. You come to their abdomen, you will see hairs, just like the male pattern of hair distribution. Now, you see someone with polycystic ovarian syndrome, sometimes they are obese. They are bigger than the normal population. Now, you see also someone with polycystic ovarian syndrome will present with abnormal breast milk discharge. This can be on its own as hyperprolactinemia or just a component of the polycystic ovarian disease. So, you can also see someone with polycystic ovarian syndrome presenting with acne. They have a lot of pimples on their faces. Polycystic ovarian syndrome can present with all these symptoms I have mentioned. However, most women in their reproductive age present with inability to conceive. With polycystic ovarian disease, there are some things that you see when you do an investigation to prove that this person actually have polycystic ovarian syndrome. And one of the things we do is an ultrasound. When you do an ultrasound of that person, the pelvic ultrasound, and looking at the ovaries, you will see the ovaries peripherally arranged with cysts like a necklace. You see each of the eggs is filled with fluid, and this fluid is about 2 to 9 millimeters. You see fluids, and most times they are arranged between 10 to 12 of eggs around that ovary, just like I'm showing in the diagram. So you see someone with polycystic ovarian syndrome, in ultrasound you'll be able to note that. More other times you will see that the ovaries are bigger than normal, actually because of the cyst, and inside this ovary you are not seeing any egg or any of the egg, that is the ova, that wants to be released as ovulation. So most times they don't ovulate. Then the second thing is that when you do a hormonal profile, we look at the follicle stimulating hormone, we look at luteinizing hormone. There's a reversal in the ratio of luteinizing hormone to follicle stimulating hormone ratio, more than 1.5 that we usually know. So these are the things when we ask you when your gynecologist will ask you to do hormonal profile. We are looking at this follicle stimulating hormone, luteinizing hormone. We're also looking at your estrogen. Then we'll also look at your prolactin. For someone that has polycystic ovarian syndrome, most times they will also present with breast milk discharge, even when they are not breastfeeding, or even when they are finished breastfeeding. So we look at the prolactin to know if the person has hyperprolactinemia. Those are the things that will prevent the person from getting pregnant. Also look at the androgens. You will see there is increased testosterone in someone that has polycystic ovarian syndrome, and that's why they have change in their voices, they have appearance, hair pattern of hair distribution on their bodies. So these are the few things you do to find out if the person has polycystic ovarian disease. Now, how do you get pregnant with polycystic ovarian disease? Remember that polycystic ovarian disease can affect anybody, any woman of reproductive age. Some women we have polycystic ovarian syndrome just immediately they are entering into puberty. Some would be between 20 to 22 years and above. You see them, they're already presenting with polycystic ovarian syndrome. However, these people have been normal before. Someone would have given birth and also present with polycystic ovarian disease. So anybody can present with polycystic ovarian disease so far you are a woman. Then also any race can present with polycystic ovarian disease. However, it's more commoner in people with family history. If you have a family history of polycystic ovarian disease in your first degree relative, your mother, your sisters, your maternal aunt, or your first degree aunt, you can have also polycystic ovarian disease. Then people with big size, we call it obesity, overweight, they can also present with polycystic ovarian disease. So getting pregnant with polycystic ovarian disease, there are several options on getting pregnant with polycystic ovarian disease. However, we start with the first thing first, because most women with polycystic ovarian disease are overweight. We try to encourage the person to lose weight as much as possible. If you are able to lose about 8 to 10% of your body weight, the persons most times sporadically ovulate. Ovulation occur on their own without even any help or any medication. So we encourage someone with polycystic ovarian disease to lose weight as much as possible. This you do by healthy eating, adequate exercise, and every other thing that will help you to lose weight. So we encourage the person to lose weight. If you're able to lose weight, you can ovulate and get pregnant. Then we'll also encourage the person as much as possible. We'll rule out every other thing that is a cause of infertility. We'll make sure that polycystic ovarian disease is the sole cause of that infertility. And when we've done that, we can place the person on drugs. Some medications, like for someone that has abnormal breast milk discharge, we can stop the breast milk discharge with the use of medications by giving the person some drugs like bromocriptine, cabergoline. We encourage the person to stop the breast from being stimulated. If the partner sucks the breast, we tell the person to hold on and stop sucking the breast for the moment. So that when the breast milk discharge and when the breast milk discharge decreases and the hyperprolactinemia decreases very well, the person can sporadically ovulate as well, and the person can get pregnant. You know, when you ovulate, possibility of pregnancy increases. Now, if these things we have done and it's not working, we can go on to give the person ovulation induction drugs. Before we give ovulation induction drug, because you know that most people with polycystic ovarian disease, as most of them see their period around 3 months of pregnancy, 2 months, of their menstrual cycle. Their menstrual cycle is not constant. So that menses happens because the uterus, the endometrial lining, has overgrown and sheds on its own. So most times they do not shed adequately, or they do not shed uniformly. So we'll try as much as possible, cause the person to shed and see her period. Then we'll now take over with the use of some contraceptives like combined oral contraceptive pill. We can do that about 2 to 3 months so that the endometrial lining will be uniform. Then we'll go on to give the person ovulation induction drug. ruling out every other cause of infertility like bilateral tubal ligation, male factor infertility. Those ones must have been ruled out. So we give ovulation induction drugs. Some of the ovulation induction drugs we use include clomiphene. When we use clomiphene citrate, most times the person may ovulate. Then if we use clomiphene citrate for some time and it's not working, we can go on to give letrozole. However, because of metabolic imbalance and also these people with polycystic ovarian disease, we also give them with metformin, some drugs for diabetes, because they present also with insulin insensitivity, insulin resistance rather. So we'll try as much as possible to control whatever that will prevent them from ovulating. So we'll give them ovulation induction combined with other drugs, including folic acid. We also place them on this folic acid so that if they are going to ovulate, let them get pregnant, avoid abnormalities in the baby. So from clomiphene citrate, we'll move on to letrozole. Most times success rates is better with the ones we use, so we'll migrate, we'll move forward. Then if we have used drugs and it's not working, they are not ovulating, remember that when we use this drug, we don't just give them the drugs and tell them to go. These patients will also be monitored with use of ultrasound for follicular tracking. So we'll track them with ultrasound and to see that they are ovulating. So and we encourage them on adequate intercourse and most times timed intercourse. So most people ovulate, most people get pregnant. If you have used drug and it's not working, we can advise on in vitro fertilization. In vitro fertilization is an artificial assisted reproductive technology. You get the woman's egg and get the partner's sperm and fertilize these eggs outside and now reimplant it back to the woman, and she goes on to carry her pregnancy. You support the pregnancy with hormones and you watch the woman now help her to get through the pregnancy, because polycystic ovarian disease is also associated with some pregnancy problems. So we'll support them as much as possible until they give birth to their babies. Now, if IVF is not working, you can go with surgery. There's a place of surgery. Initially, traditionally, a wedge resection was advised. However, currently, the surgical means of helping women with polycystic ovarian disease to get pregnant is with use of ovarian drilling, because the capsule of the ovary in polycystic ovarian disease is thick and most times they will not be able to ovulate. So you go and make some holes on the ovaries. We'll call it ovarian drilling. With ovarian drilling, most of them go on to start ovulating and they get pregnant. However, before these things are done, we make sure that the partner's seminal fluid analysis is normal and adequate for fertilization. So these are the ways to cause someone with polycystic ovarian disease to get pregnant. Thank you for watching to this point. If you have not subscribed to my page, subscribe to my page. Drop your question in the comment section. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. Subscribe to my page on YouTube, Instagram, TikTok, and Facebook. Like this video, share it. See you next time for another enriching video. Thank you.